Welcome to the new Equity and Fairness strategy for West Yorkshire Health and Care Services. Here's some of our key takeaways from the strategy as Healthwatch working together across West Yorkshire. You'll also hear from a West Yorkshire Voice member who was involved in sharing their ideas about what should be in this strategy. We really encourage you to read and be involved in this strategy. We're really pleased to see that the strategic objectives for the new Equality, Diversity and Inclusion strategy really reflect what people told us both in our workshops run in 2024 through West Yorkshire Voice and what we regularly hear from our local people and communities through Healthwatch. We strongly support the focuses on both listening to communities and making real changes based on feedback, as well as having processes in place to make sure that impact actually happens and that there is clear accountability. We should involve our communities in health and care decision making at every level and in every service or area of health and care. This should be on an ongoing and meaningful basis, and we must do more work towards a culture that consistently welcomes and seeks out feedback, seeing this as a really valuable opportunity to improve services. Without this shift, many communities may continue to not feel the impact of our efforts towards equality, diversity and inclusion. People's experiences, access and opportunities will not improve if we do to and not with, if we assume and we don't ask. We have also been reflecting that equality, diversity and inclusion strategies sometimes sit pigeonholed over there, instead of being central to the delivery of core services. This is not a minority community. This is a significant part of who we are as West Yorkshire, and services should be inclusive to all. We hope this strategy starts to ask the questions of how do we move equality, diversity and inclusion into core business and not over there, not forgotten, as well as how do we then measure and hold services accountable to that. Here's one of our West Yorkshire Voice members telling us why it's important to see a focus in the new strategy on listening to and acting on people's feedback. They were involved in our focus groups last year and their words are read out by one of our volunteers.
I feel this will be a massive breakthrough for the future if health and care professionals and patients are actually working together. Professionals will need to truly listen to patients and then directly take action informed by the feedback received. It is extremely important that this is genuinely done, not just lip service. By sincerely hearing and using the voices of lived experience to improve experiences of and access to services, I feel services and professionals will have a real chance to positively help patients and have an improved impact. This will greatly enable people's recovery, improving satisfaction for all. I believe working together is the crucial aspect. It needs to no longer be a them and us mentality, but an equal partnership. Where this happens, I flourish and feel most heard. I look forward to seeing this continually happen in the future.